Welcome back. I'm Liam Stapleton, consultant podiatrist and specialist in podiatric sports medicine, and we're going to take a look through another treatment video. Today's demonstration is of nail surgery for an ingrowing toenail. This particular case has been causing trouble to the medial sulci of the left nail. There is also a fungal infection to this area of nail also, which has failed to resolve with medication, both topical and oral medication. For this procedure, we're going to kill two birds with one stone. We're going to remove all of the fungally infected nail and remove the corner of nail causing the ingrowing toenail. This is normally slightly more difficult as onychomycotic nails, fungally infected nails, are very brittle and often break when they're being removed like this. So the toenail is anaesthetized with local anesthetic at the base of the big toe. This means that the big toe is completely numb, but the rest of the toes and the rest of the foot can feel. And for this reason, it's a safe and quick procedure that can be performed in an outpatient setting. We always ensure we have a sterile field and utilising sterile non-touch technique. The nail is cut along the line previously decided. I always like to draw on the nail before we begin nail surgery, and this also helps with consenting a patient. In this case, I have managed to remove the entire piece of nail with a margin for the fungally infected nail. This is slightly larger nail removed for a partial nail procedure of mine, but for this good reason. It is also important to remember to check the entire nail plate has been removed under the sulci, otherwise we'll almost certainly have an ingrowing toenail return. Now, we are utilising Fungal to chemically ablate the nail bed, preventing the piece of nail removed from returning. This is important to do this under a tourniquet, as blood neutralises the Fungal and again almost certainly result in nail regrowth. There are different guidelines on how long to phenolize the nail bed for. I like to work on a case-by-case basis, ensuring that we see change in colour throughout the area being chemically ablated. You go a white-grey colour. Once this has been achieved, I'm happy the procedure is complete. The tourniquet is removed. Over-phenolizing a nail can cause a bad reaction and slower healing times. We ensure that the toe is reperfused before dressing. I generally use a Counterstat dressing, which helps with coagulation of any blood. One of the main risk factors for nail surgery post-operatively is post-operative bleeding. I like to apply a crepe bandage with a light compression to ensure the toe has significant compression to prevent bleeding, especially in cases of patients on anticoagulation medication. But this cannot be too restrictive, as this can result in pain, especially during the night. On the day after the procedure, I always counsel every patient that should they experience episodes of night pain following the nail surgery procedure, that the dressing is to be removed and redressed. The procedure is quick and painless, and we operate with between 95 and 97% success. In these cases, no prophylactic antibiotics have been necessary, and my audits show that only about 5% of cases become infected. Thank you for watching this video, and if you have enjoyed it, please like the video and subscribe to the channel, and I will welcome you back to another one of my videos on my channel. Many thanks.